welcome to the Deep Dive. Today we're tackling something we all do, sleep.
Yeah, it's fundamental, isn't it?
It really is. And it's kind of mind-blowing when you think, like our sources say, we spend about a third of our lives asleep.
A huge chunk of time. And, for something so universal, how it actually works and affects our health is, well, it's pretty intricate. Often overlooked, I think.
Totally agree. So that's our mission today, really, to unpack this fascinating world of sleep for you. We've got some great in-depth sources here, and we're going to try and boil it down. We'll look at the biology, the different stages we go through.
How it changes as we age.
Right, and all those things that can either help us get that amazing restorative sleep or just, mess things up completely.
And these sources, they give us a really solid health perspective, which is so important because sleep isn't just feeling rested or not. It hits everything: mood, immune function.
You name it. And speaking of impact, here's a stat that really made me pause. 50 to 70 million Americans have some kind of sleep disorder.
Wow. That's a staggering number.
Isn't it? 50 to 70 million people whose daily lives, their health, are being affected. Makes you really think about how vital this is.
Absolutely. It underlines why understanding sleep matters so much. It's not passive downtime. It's an active brain state controlled by these complex systems.
Okay, so let's get into those systems. Both sources point out sleep isn't just like flipping a switch off. It's cyclical.
Right.
And it's run by the lower part of the brain. They mentioned this thing called the reticular formation, kind of like a sensory information hub in the brainstem.
Exactly. Think of it like Grand Central Station for sensory input. It gets signals from all over the body, and then it kind of decides what information gets passed up to the cerebral cortex, the thinking part of the brain.
That's why like a loud bang can just snap you awake.
Precisely. It's monitoring. And that brings us to the reticular activating system, the RAS. Crucial for that sleep-wake balance, like a dimmer switch for consciousness, you could say.
Okay. And our sources also mention a whole cocktail of chemicals involved neurotransmitters. Things like serotonin, GABA, acetylcholine, dopamine, noradrenaline.
Yeah, these chemicals are the real drivers here. Serotonin and GABA, for instance, they seem to help inhibit the RAS, calm things down for sleep.
Right.
Whereas acetylcholine, dopamine, noradrenaline, they're more linked to being awake, alert. It's this constant push and pull.
It's fascinating how darkness and even just our regular bedtime routines can actually help quiet down that RAS stimulation. And when that happens, the pineal gland starts pumping out melatonin with the sleep hormone, right? Makes us feel less alert.
Yep, ready for sleep. And then during sleep, you get this hormonal shift too. Growth hormone goes up, cortisol, the stress hormone goes down.
So you can really see how our environment, our habits, they have this direct biochemical effect on our sleep cycle.
Totally connected. And that cycle, as the sources mention, is tied into our circadian rhythm.
Ah, the body clock, that internal 24-hour pacemaker.
That's the one. And circadian synchronization is just when that internal clock lines up nicely with our sleep-wake pattern. Ideally, most awake when body temp is highest, sleepiest when it dips.
And it gets going pretty early, doesn't it? Sources say most babies establish that rhythm by just 3 to 6 months old.
Yeah, it shows how fundamental it is. Which leads us to the structure of sleep itself, the sleep architecture.
Okay, so the building blocks, 2 main types. NREM, non-rapid eye movement sleep.
And REM, rapid eye movement sleep.
And they don't just happen randomly, they alternate in cycles all night long.
Exactly. And understanding what happens in each state is key to getting why we sleep. Should we start with NREM?
Let's do it. So NREM happens when that RAS activity quiets down. And it's the bulk of our sleep time, right? Like 75–80%.
That's what the sources say, yeah. A big chunk. And it used to be 4 stages, but now it's generally seen as 3.
Right. They combine the old 3rd and 4 into just stage 3 now.
Correct. And each stage has its own kind of signature.
Okay, walk us through it. Stage 1.
Stage I is that super light sleep. Just lasts a few minutes usually. You feel drowsy, relaxed.
Eyes might roll a bit. Heart rate slows a little.
Yep, exactly. And you're easily woken up. You might even say, I wasn't asleep, if someone nudges you. We've all been there, right?
Oh, yeah. That twilight zone. Okay, then stage 2.
Stage 2 is still light sleep, but a bit deeper. Lasts maybe 10–15 minutes. Body processes keep slowing down. Eyes usually still.
Heart rate, breathing rate drop a bit more. Body temp falls.
And this stage actually makes up a huge portion of total sleep, like 44–55%. Takes a bit more to wake you up now.
Right, you're settling in. Then comes stage 3. The deep stuff.
This is it. Delta sleep, deep sleep. Heart and respiratory rates drop way down, maybe 20–30% below waking levels.
And it's really hard to wake someone from this stage. Like, noise doesn't bother them much.
Very difficult to arouse. Muscles are super relaxed, reflexes diminish. This is prime snoring territory, too.
Huh. Good to know. And saliva production slows down. Explains the dry mouth, maybe.
Could be. And physiologically, stage 3 is crucial. The sources stress this. It's vital for restoring physical energy, releasing growth hormone for body repair.
Gotcha. So NREM overall is like a big system restore. You mentioned blood pressure drops, pulse slows, blood vessels widen.
Cardiac output decreases slightly, muscles relax, even your basal metabolic rate dips 10–30%. Growth hormone peaks, intracranial pressure goes down. It's a full body reset and repair phase.
Okay, makes sense. Physical restoration. Now, what about the other side? REM sleep.
Right, REM sleep. Famous for dreaming, it usually shows up about every 90 minutes or so through the night.
Lasts maybe 5 to 30 minutes each time. And the sources mentioned a boost in acetylcholine and dopamine then.
That's right. And yes, this is where most of our really vivid, sometimes totally weird dreams happen, though you might only remember them if you wake up right at the end of a REM period.
Ever had one of those dreams where you think, where did that come from?
Exactly. That's probably REM. What's really wild about REM is how active the brain is. Metabolism can jump up by 20%. Yeah, and the EEG, the brain waves, look almost like you're awake. That's why it's sometimes called paradoxical sleep.
Paradoxical.
Yeah.
Because your brain's buzzing, but your body is.
Pretty much paralyzed. You get those signature rapid eye movements, but voluntary muscle tone drops dramatically. Deep tendon reflexes are gone too.
Wow. So your brain's watching a movie, but your body can't join in.
Kind of. And despite that brain activity, waking someone from REM can be tricky, or they might just wake up on their own, often remembering the dream.
And physically. Gastric secretions increase, heart rate gets irregular.
Yep, stomach acid goes up, which can be relevant for reflux sufferers. And heart and breathing rates can become quite variable, speeding up, slowing down.
And the sources say brain regions for learning, thinking, organizing information are stimulated during REM.
That's a key point. It seems really important for cognitive functions, consolidating memories, maybe processing emotions, even problem solving.
So not just weird dreams then. Real brain work happening.
Definitely. Okay, so how do these NREM and REM stages fit together across the night, these sleep cycles?
Right, it's not just one block, these repeating patterns. Sources say a typical cycle for adults is about 90 to 110 minutes long.
Mm-hmm.
And over a 7–8 hour night, you typically go through, what, 4 to 6 of these cycles?
Sounds about right, like a journey through different sleep landscapes each night.
And if you get woken up mid-cycle...
You basically have to start over at stage I NREM when you fall back asleep. No picking up where you left off.
Like hitting reset.
Yeah.
And the pattern changes through the night too, right? Early on, more deep NREM.
Exactly. More stage 3 early in the night. Then as the night wears on, you spend less time in that deep sleep and progressively more time in REM.
Which is why dreams often get longer and maybe more intense towards morning.
That's the thinking, yeah. And just before you naturally wake up, you often have these periods of lighter sleep, more stage I and 2, and REM again. It's a gradual climb back to wakefulness.
Okay, so we know it happens. But why? Why do we actually need sleep? What's its job?
Well, fundamentally, sleep seems crucial for restoring balance in the nervous system, giving the brain a chance to sort of reset and consolidate after being active all day.
Makes sense. And it's not just the brain, right? Sources say it's vital for protein synthesis, for repair processes.
Absolutely. It's prime time for the body's repair crews to get to work, fixing tissues, building proteins.
And then there's the psychological side. We all know how awful we feel after a bad night.
Oh, definitely. Psychological well-being tanks without good sleep.
Sources mention irritability, poor concentration, difficulty making decisions.
Yeah, just feeling emotionally fragile, finding it hard to focus. Your mental horsepower just isn't there.
So true. Now, how does this all change as we age? Sleep patterns aren't static across our lifespan.
Not at all. They change quite dramatically. Let's start right at the beginning. Newborns.
Okay, the sleep champions.
Yeah.
Like 16 to 18 hours a day. But in short bursts, right? 1–3 hours.
Yep, little naps broken up by feeding. And interestingly, unlike us, they jump straight into REM sleep.
Wow. And it's like 50% MREM, 50% REM with super short cycles, 50 minutes.
That's right. A very different sleep world. And the advice for parents is key. Put them down drowsy but awake. Helps them learn to self-soothe.
Good tip. And encourage less daytime sleep with light and play.
Helps set that day-night rhythm. Then for infants, they start stretching out nighttime sleep. waking every 3-4 hours at first.
I'm gradually longer stretches. By 6 months, maybe sleeping midnight to 5 a.m. and getting into daytime naps.
Usually, yeah. And remember, about half their sleep is light, active sleep, so lots of little movements were normal. Again, putting them down drowsy is good practice.
Okay. Toddlers next. 12-14 hours needed. Still need that afternoon nap.
Most do, yeah. This is also when nighttime fears or nightmares might pop up. A security object, like a special blanket or toy, can really help.
Makes sense. Preschoolers, 3,000 years old, about 11-13 hours.
That's the recommendation. Needs can vary a bit with activity levels, growth spurts. Consistency and schedule is key here.
Might get some bedtime battles, though, and maybe limit TV to help with nightmares.
Common challenges, yeah. Then school-age kids, 5-12, still need a fair bit, 10-11 hours.
But often don't get it right. Homework, activities, screens, maybe caffeine.
They'll start competing for sleep time. It's a challenge.
And then teenagers.
Adolescents. They actually need quite a lot, 9 to 10 hours. But very few get it.
Why is that? Their body clocks shift later.
Exactly. Their circadian rhythm naturally pushes them to stay up later and wake up later, which clashes badly with early school starts.
And the consequences are serious. Lower grades, bad moods, even higher risk of car crashes.
Sadly, yes. Chronic sleep debt is a real problem. And often, teens and parents have different ideas about how much sleep is needed or being had. Plus, smartphones are a huge factor cutting into sleep.
Okay, moving on to adults. Most need 7-9 hours, though it varies.
Yep, 7 to 9 is the general guideline for healthy adults. But some groups struggle more: students, shift workers, travelers, new parents.
We know that feeling. And the signs you're not getting enough. Dozing off easily, trouble concentrating, irritability.
Short-term memory problems, too, all classic signs. Though a well-timed nap can sometimes help boost mood and memory for some adults.
But adult sleep can be fragile. Stress, depression, pain, shift work, parenting, even biological stuff like pregnancy, hormones.
All sorts of things can disrupt it. Perimenopause is another one.
And older adults. Tendency to go to bed earlier, wake up earlier.
Often, yes. And sleep can become more fragmented, more awakenings. Importantly, their need for sleep doesn't decrease, but the quality might change.
Circadian rhythm flattens a bit, harder to fall back asleep, less REM.
That's common. Daytime napping might increase but can sometimes interfere with night sleep. And medical conditions, pain, or dementia-related issues like sundowning can really impact sleep too.
Wow, it's clear sleep is so interconnected with everything else. Let's talk about factors affecting sleep more broadly. Illness seems like a big one.
Definitely. Lung problems making breathing hard, ulcers acting up with that REM stomach acid.
Endocrine issues, like thyroid problems, or low estrogen causing hot flashes.
Yeah. Hyperthyroidism can delay sleep onset. Hypothyroidism can reduce deep sleep. Even just having a fever can mess with deep sleep and REM. And of course, needing the bathroom frequently.
Environment too, right? Noise, temperature, light, even your partner snoring.
Absolutely. An unfamiliar place, an uncomfortable bed, all these things matter.
And lifestyle choices. Irregular schedules.
Yeah.
Exercising too late.
Both can delay sleep. Not having a wind-down routine is another big one. The advice is clear: keep work out of the bedroom.
Makes sense. And night shifts are a constant battle against the body clock. Dark glasses and blackout shades help.
Essential tools for shift workers trying to sleep during the day.
What about emotional stress? That's huge, isn't it?
A major cause of insomnia. Anxiety ramps up norepinephrine, which leads to less deep sleep, less REM, more waking up. Your mind just won't switch off.
And stimulants. Caffeine.
Alcohol.
Caffeine is obvious, stimulates the nervous system. Avoid it in the afternoon or evening if you're sensitive. Alcohol is tricky.
It makes you drowsy at first. Yeah, it might help you nod off faster, but then it fragments sleep later, especially REM. Can even cause nightmares during the rebound.
Diet. Does that play a role?
It seems so. Weight gain is linked to less total sleep, more broken sleep. Weight loss sometimes improves it. The L-tryptophan thing in milk or cheese is often mentioned, but the evidence is a bit weak.
Smoking. Nicotine's a stimulant, right?
Yep. So smokers often have more trouble falling asleep, wake easier, sleep lighter.
And motivation. Can you just power through?
Maybe temporarily, but usually your biological need for sleep wins out over willpower eventually.
Finally, medications. Lots of potential impacts there. Sleeping pills, beta blockers, narcotics.
Even tranquilizers and antidepressants. Many common meds can interfere with sleep stages, especially REM. Hypnotics might reduce deep sleep. Beta blockers can cause insomnia or nightmares. Narcotics suppress REM.
Antidepressants sometimes suppress REM as part of how they work, but stopping them can cause REM rebound.
Exactly. It's complex. Always something to discuss with your doctor if you suspect meds are affecting sleep.
Okay, so with all these potential disruptors, it's no wonder sleep disorders are common. Let's touch on the main ones. Insomnia first.
The classic. Trouble falling asleep, staying asleep, waking too early. Leads to daytime fatigue, poor concentration, irritability. More common in older adults and women, apparently.
And treatments are often behavioral. Stimulus control, CBTI, sleep restriction.
Those are usually the first line, yeah. Helping retrain sleep habits and thoughts.
What about excessive daytime sleepiness? That's a category, right?
Yes. Includes hypersomnia, sleeping enough at night but still being excessively sleepy by day, often due to other medical or psychological issues.
In narcolepsy, that's different. Neurological.
Very different. Lack of hypocretin in the brain. Causes irresistible sleep attacks, often starting with REM sleep. Can also involve cataplexy, sudden muscle weakness, sleep paralysis, hallucinations.
Treatment involves stimulants. Modafinil.
Often CNS stimulants, sometimes antidepressants, modafinil, or sodium oxybate, specifically for cataplexy.
Then there's sleep apnea. Those pauses in breathing during sleep.
Right.
Yeah.
More than 5 pauses an hour, or pauses longer than 10 seconds. Big symptoms are snoring, waking up gasping, headaches, memory issues, irritability.
And types. Obstructive is a blockage. Central is the brain. Mixed is both.
That's it. Obstructive is the most common. Treatment often involves CPAP machines, maybe surgery. Weight loss is key if relevant.
And is serious if untreated. Can affect work, blood pressure, heart.
Absolutely. Increased risk of high blood pressure, heart attack, arrhythmias, even heart failure needs to be taken seriously.
And just insufficient sleep. Not a disorder per se, but just not getting enough.
Exactly. Leads to sleepiness, fatigue, attention problems, reduced motivation. The source comparison to blood alcohol content is sobering.
19 hours awake, like 0.05 BAC. 24 hours, like 0.10. Wow.
Really highlights the impairment. And sleeping way more on weekends is a big clue you're sleep deprived during the week.
Lastly, parasomnias. Those weird behaviors during sleep.
Yeah, things that interfere with sleep, like sleepwalking or sleep terrors during NREM.
Sleep talking during transitions.
Nightmares during REM.
And others like teeth grinding, bruxism, bedwetting, enteresis, or restless legs. Well, periodic limb movement.
Periodic limb movement disorder, yeah. Those leg jerks during sleep. A whole range of disruptive events.
So if someone's having trouble, how do doctors figure out what's wrong? What's the assessment process?
It's pretty thorough. Usually starts with a detailed sleep history, health history, a physical exam, maybe a sleep diary. Sometimes diagnostic studies are needed.
Sleep history first. What does that cover?
Usual sleep-wake times, naps, bedtime rituals, snoring, daytime sleepiness, all medications, prescription, OTC, herbal. If there's a specific problem, getting deep into its nature, onset, frequency, impact, what's been tried.
Health history to rule out other causes. Medical, psychiatric, meds again.
Crucial. Things like depression, Parkinson's, arthritis can all affect sleep. Got to check everything.
Physical exam. Does that usually find much?
Often not, unless it's maybe signs pointing towards obstructive sleep apnea, like enlarged tonsils, big neck circumference, deviated septum sometimes.
Okay. And the sleep diary. Tracking everything.
Yeah, for a week or two usually. Sleep-wake times, time trying to fall asleep, awakenings, naps, activities before bed, caffeine, alcohol, meds, rituals, daytime sleepiness levels, worries. It builds a real picture.
And if that's not enough, diagnostic studies, polysomnography.
That's a big one. The overnight sleep study hooked you up to monitor brainwaves, EEG, muscle activity, EMG, eye movements, EOG.
Breathing, heart rate, oxygen levels, leg movements.
Exactly. Gives objective data on sleep stages, breathing events, limb movements, oxygen drops. Really helps diagnose things like apnea or PLMD.
This has been incredibly insightful, really peeling back the layers on sleep.
It's a complex and vital part of our lives.
Definitely. So thinking about all this, the brain chemistry, the hormones, our habits. Here's a final thought for you listening. What's one small change you could maybe experiment with this week? Just a tiny shift to nudge your sleep towards feeling more restorative, more energizing.
Could be anything, really. Maybe timing your coffee differently.
Or creating a slightly more consistent wind-down routine, making the bedroom darker, quieter.
Just something small to explore based on what we've talked about. Reflecting on your own habits.
It's worth considering. It really is about becoming more aware, isn't it? Finding what works for you.
Absolutely. Small adjustments can make a surprising difference over time.
Well, thank you so much for diving deep with us into the science of sleep today.
My pleasure.
We genuinely hope this has highlighted just how crucial sleep is for body and mind. Understanding how it works, how it varies, hopefully empowers you to prioritize it a bit more.
And we'd love to hear from you. Share your own sleep thoughts or any questions that came up on social media, or get in touch through the usual channels. Let's keep the conversation going.
Please do. And make sure you join us next time for another deep dive we'll be exploring. Well, you have to tune in to find out. Until then, sleep well.
Sleep well, everyone.